All right, a warm welcome back for those of you who are attending Teach to Reach All Day. We've just started the live stream, 8 minutes away from starting this really a sneak preview for the special event that we'll be holding on Tuesday in partnership with RBM, the Partnership to End Malaria. So last month, very recently, the Geneva Learning Foundation joined in partnership with RBM, and we're very pleased to be sharing this mini event ahead of the let's say more comprehensive event that we'll be holding on Tuesday. It's what we call a special event. We'll have simultaneous interpretation so that both Anglophones and Francophones, health professionals who are tackling malaria, can speak across the language barrier, and of course we'll have people from all malaria endemic countries. So we're very pleased to be connecting with everyone here, and I'm going to turn it over to Charlotte to see if there is anyone we can speak with during the final few minutes. As people on the conference platform again are, this is a brand new platform for even seasoned Teach to Reach participants. So we very much encourage you. So you need to, in order to access the session, you need to first reserve a spot, and then you can actually join here. So that is the key. If you do not do that, if you do not reserve a spot, you will not be able to join the session. This is so we can count how many people are actually participating. So all right, over to you, Charlotte. We're going to maybe have a little bit of a softer music. Let me change the mood here. And we know that as people are still figuring out the platform, they're still joining the session. Over to you.
Thanks, Reda, and a warm welcome once again. So I have Maman Godzia invited you to unmute, and I'm encouraging everyone, if you haven't spoken since morning, if I call upon you, please just go ahead and unmute yourself, introduce yourself, and tell us why are you interested in this session that is focusing on malaria. So Maman Godia, over to you.
Okay, good afternoon, Charlotte. Thank you for the opportunity. I've been in all the sessions all through. I actually reserve a seat for all the sections. So why I decided to join this is because there had been an outbreak lately in where I stay. I base in Sokoto, Nigeria, and I work with UNICEF as social behavioral change consultant in a local government, Kware to be precise. So there was an outbreak of malaria of recent in this region of ours due to the heavy rainfall and flood in some of those communities. So I just want to learn more on how I can, impact and change. And there's been weather change here. Actually, there's climate change over here. The weather has drastically changed, and the mosquitoes are still persisting over here. And so, although there have been some little interventions from Malaria Consortium to help curtail and administer some free drugs to the children and mosquito net to the caregivers, but there are still some communities that are still hard to reach because of insecurity, because we suffer it here in the north very well. And so because of that, I just want to learn better ways on how to help and from other participants to find a way to help and assist those in those difficult, hard to reach villages or communities, because it's actually a burden. Because of here, there's banditry and kidnap here very well. So we can't reach out to them and support them. So I'm also looking forward to learning ways on how we can afford to send them help in those places, because we actually get reports of high number of deaths due to cerebral palsy and malaria there. So thank you very much.
Okay, thank you so much, Maman Godia, for sharing. And you mentioned climate change and health, and just to let you know, as I'm sure you already do, and that you have reserved your spot for the session after this one, which will be with Grand Challenges Canada, focusing on climate change and its impact on health. So we have Ukasha Sultan. Ukasha, earlier on you were unmuted. Please, can you go ahead and unmute yourself again? And I'll also curious to hear from Angelina Jato that I'm inviting to unmute. Ukasha, are you able to unmute yourself? Your hand is raised. Okay, over to you.
Good afternoon, everyone. I am Ukasha Abubakar Sultan from the Federal University of Health and Science, Azare, Bauchi State, Nigeria. So I'm very, very interested about this program. This issue of malaria. The malaria is very, very, let's say the climate change has affected all the health workers in there. So because of this malaria, it's affect our people, especially in my zone, Northeast.
Okay, thank you so much, Ukasha Sultan. So, and just so you know, like Reda said, this is a sneak preview of the malaria special event that we are going to the Geneva Learning Foundation in partnership with the Rollback Malaria Partnership to End Malaria will be holding. That is next Tuesday, that's the 10th of December. And so I put the link in the chat if you have not yet requested your invitation and registered to join. But if you're on this platform, you should reserve your spot because spaces are limited. And Reda, I'm turning over to you because I know we are going to start the countdown.
Thanks, Charlotte. And wonderful to be here. We're 1 minute, 15 seconds away from getting started. This is a sneak preview. As Charlotte just said, we're holding a special event specifically for malaria with RBM Partnership to End Malaria. That is on Tuesday, the 10th of December. The time is going to depend on where you are in the world, but it's 12 p.m. So it's noon in Geneva and 11 a.m. Universal Standard Time. So we're 50 seconds away from counting down. Today is a sneak preview. If you are watching this on the live stream, I encourage you to register, request your invitation, join the Teach to Reach platform. It's an amazing platform. We're 30 seconds away, so I'm not going to show you very much, but you can really meet, network, and learn. You can see here at the top right, there are more than 15,000 health professionals registered for this event, and you can access the full participant list, find people that you are interested in connecting with in various ways, as well as join these sessions to meet, network, and learn. Right after this session, we'll have the session on climate change and health, and then we'll have a final session entirely dedicated to networking. So I believe we should be close to the countdown here, and here we go. All right, a warm welcome to you from Geneva, Switzerland. Here we go. We're starting this. We're very excited about this session. Of course, this is malaria is an issue, an affliction that affects all of us. And this is why we're very pleased to be welcoming RBM Partnership to End Malaria as a new Teach to Reach partner. We'll show you exactly how RBM framed its engagement in supporting Teach to Reach. Charlotte, I'm going to ask you to read it, of course.
To end malaria, we must empower the people closest to the problem. That's health workers in affected communities. This partnership with the Geneva Learning Foundation allows us to listen to and learn from those on the front lines of malaria control, ensuring that their voices drive our global strategies and actions towards elimination.
All right, wonderful. And we are, this is a sneak preview today, and we're then holding a special event on Tuesday, the 10th of December, Health Workers United to End Malaria. Now, there are already outputs of Teach to Reach 10, really focused on health worker perspectives on malaria. You can see some of them here on screen. We invite you to, everyone who registers for the malaria special event will automatically receive the eyewitness report. Now, ahead of Teach to Reach 11, we asked you a number of questions when we introduced the partnership around how malaria has impacted your life, your family, your community. and then to share how changes in climate and adverse weather have affected malaria in your community as well. So it also much more detailed set of questions in both French and English, as you can see here, to share experiences with malaria. Charlotte, is there, of the 10 questions that we asked, is there one that you feel is particularly important from your perspective?
Whether it's hard to choose, all the questions are quite significant. But the first question really speaks to me because malaria actually affects me, my immediate family, and my community. And it's something that I really have a passion when it comes to tackling it. So I'm also very much interested in the questions around how communities and members of the community get to use insecticide treated bed nets.
All right. And then we also had a question specifically on malaria vaccination. So these, we started asking them at Teach to Reach 10, and we've continued to ask them through Teach to Reach 11 to continue collecting, really helping you share your experiences. And of course, this is something that we're going to give back after Teach to Reach 11. The experiences shared collection for Teach to Reach 10 is already available. And I suggest, Charlotte, that we start there, really looking at, and let me see how I can bring this up on screen. So we asked these questions, and we saw, for example, from Afghanistan, Syed Ashukula Majidi, who's a public health specialist for a national NGO who works in Logar, Faryab, Samangwan, and Parwan, who says, we have a malaria project at the community level to decrease cases at provincial level. We regularly follow cases and treatment considering malaria guidelines. And he also says, my family members are healthy and not affected by malaria. So that is one example of a health worker testimonial in response to these Teach to Reach questions. We're going to now open up to the Teach to Reach participants. If you are watching on YouTube or another social media channel, we see your comments. There's a little bit of a delay, so we know that, so we'll be looking for your comments coming in. And then for those of you who are with us on the conference platform, we'd like to invite you to tell us about a specific time when severe malaria affected someone close to you, your family member, friend, or patient. What exactly happened? What did you do? And how it turned out. So we're going to start, perhaps let's see if Gladys, Abena, Osua, Gideon Johannes, Naomi Joshua, Muazu, Ukasha Sultan, your microphones are active. Please go ahead and either raise your hand or just unmute if you'd like to share with us. And we have actually two hands raised already. So Margaret Nabagala, as well as Joseph and Gugi. So Margaret, we're asking you to unmute. Joseph, we heard from you, of course, and you're a long-standing member of the Teach to Reach community, a leader as a scholar in the Movement for Immunization Agenda 2030. Joseph, would you like to kick us off and tell us how malaria has affected you?
Yeah, good afternoon, morning, everyone. I'm Joseph Gugi from Murang'a County, Kenya, and I'm a community health officer. Malaria had affected my wife. In fact, about 3 weeks ago, and she could not even move. She was feeling cold, headache, and she could not do any activity. It took her 3 days to heal, and in fact, she had to be injected instead of taking the oral medicine, and that one affected her activities, and also it affected me. It affected us both psychologically and the whole family. Thank you.
Thank you, Joseph. That sounds very recent. Do you think it's different for you as a health worker? You, of course, probably know a lot more than many people that are not health workers. Do you see any other differences in terms of how having your wife, your other health affected and severely so? It sounds like. Is there anything different from your perspective because you are working for health?
Yeah, I saw it differently. I saw it. Anybody can be infected with malaria, regardless of wherever she is. Sometimes it's not something. It's beyond somebody's control because he has gone to a prone area malaria. So anybody can be affected by malaria.
And Joseph, if you had one question for your colleagues, including those who are specialists in malaria, who really they work for the National Malaria Control Program, what is it that you would like to know through Teach to Reach? What are you expecting to? What are you hoping to hear in terms of the experiences shared and the knowledge that health workers have about this disease?
I'd like to know more about the malaria vaccine.
Okay. Yeah, understood. Yeah. All right. Thank you so much, Joseph. And thank you for contributing to Teach to Reach once again. Now,
thank you.
Let's go to Margaret Nabagala. I hope I'm not mispronouncing your name, Margaret. We'd love to hear from you, and thank you.
Yes, thank you very much. Hello, do you hear me loud and clear?
Loud and clear, yes.
Do you hear me? Okay, I'm called Margaret Nabagala Ntambazi, and I'm a Ugandan. I'm a public health specialist. About malaria, actually, the experience I had a colleague of mine, a very close friend of mine, had a child about 5 years old who suffered from malaria very recently, and we had to really all panic because the child was seriously sick. We had to take the child to the hospital. The area that I come from in Uganda is southwestern Uganda, called Masaka City. So we had to go to Masaka Regional Referral Hospital. We took the child to the hospital. The child was really very ill. They had to put her in intensive care unit. They had to put her testnet drip. And sooner or later, the child improved. In 2 days' time, the child was discharged. What we had to do as public health specialists is to make some health education talks in my area and the area where that child is coming from. These days, there's a lot of rain. Rain is very, very much here and there. So and the shrubs are growing so high. People are growing maize, and maize has this kind of flower where mosquitoes hide. And so we had to make public health, we as public health specialists, we had to make health education talks to the villages. We had to organize community dialogues. We had to tell them about malaria and how it spreads. And the best control is to see that these shrubs that grow very high up, especially during rainy season, that they slash them, and also try to avoid growing maize very near the house, and also different methods of the measures of controlling malaria, like closing doors and windows before night, and also sleeping in insecticide mosquito nets. And also avoid using the nets. The government gave out so many nets to each family in Uganda, but some people use them for spreading maybe coffee on them. Others use the nets for other, like fishing. So we tried to tell them to not really to use the nets in that fashion, but to see that each and every person at least sleeps in under insecticide mosquito treated nets. And this is how we go. So people have really complied, and we shall have to arrange more of such talks. Thank you very much. Over to you, Chair.
Thank you, Margaret. We're not quite done with the questions. What would you like to learn through Teach to Reach from the experiences that others are going to share? Can you give us one question that you are especially interested in, a problem that you're facing, where you would welcome support and the feedback and insights and ideas from your colleagues?
Thank you very much once again. Yeah, I would like to learn about malaria because they have been promising that we have been immunizing against so many other diseases, but malaria, and with Uganda, malaria is very rampant. It is number one killer. Number one killer. So what we are looking for is when will this immunization against malaria come? And also because much as we health educate people about prevention of malaria, still many don't comply, others don't really stick to what our advices are. So the best thing would be a production of immunization against malaria, so that we vaccinate it and put it in our routine program, so that each and every child, and maybe even adults, if possible, be immunized against malaria. So I'd like to learn about that. Thank you very much once again.
Thank you very much indeed. Now, This today is a what we call a sneak preview ahead of the main special event we'll be holding on malaria. Let me show you what that looks like. If you go to www.learning.foundation.
Excuse me.
Yes. Oh, I think Margaret maybe had additional things to say. We'll go back to her. But here, just want to show you, make sure that everyone who is participating in Teach to Reach 11 today on Thursday understands that the big special event focused on Health Workers United to End Malaria. So sharing of experience, exploring many more questions. I'll show you some of the questions we'll explore after this sneak preview and on Tuesday. So think of a particular moment when you could not get malaria medicines or tests when you needed them. Can you walk us through what happened? That's what will be one of the questions we'll ask you on Tuesday. And if you received a guest of honor invitation this morning for Teach to Reach 11, we realized that was last minute, but we wanted to include all of those of you who have contributed experiences about malaria for the special event, and we'll be inviting you as guests of honor there, where you know you are expected. Another question we'll be exploring: what do you do in your work to ensure that pregnant women do not get malaria? About prevention as well as treatment.
Excuse me, 1 minute.
Yes, go ahead, Margaret.
I just wanted to extend my apology. I was invited as a guest of honor, but I had some sick patients. Actually, my mom is sick, and I was not there at the opening session. So my apologies. Thank you very much. That's what I wanted to say.
Okay, thank you so much, Margaret. We hope that your family is going to get better soon. And thank you for joining for this afternoon session. So we'll be exploring many different questions at the Tuesday special event, a time when your community came together to fight malaria in a way that really worked. We'll ask you then, what exactly did people do, who got involved, and what made it successful? And then we'll ask you to describe a specific moment when you noticed changes in the weather over time were affecting malaria in your area. So this is related to climate change, but it's hard to tell if climate change has actually happened or not. And then, as I said, we'll also be sharing on Tuesday the collection of health worker experiences. We've shared one collection already with RBM, and this is a full set. We'll just give you a sneak preview. We showed one from Afghanistan, but there are contributions from many other countries: Burkina Faso, Cameroon, the DRC, Ethiopia, Gambia, Ghana, India, Kenya. You can see the different contributions here, and those who took the time to answer these questions, one or more of the Teach to Reach questions, are the ones who will be invited on Tuesday. We're invited today for this session as guests of honor, but as you can see, this is a very rapid sneak preview. From Nigeria, of course, many contributions as well that you can see here. I'm just scanning through a few of them, but we'll be really digging into these questions on Tuesday, the 10th of December at the special event. So we hope that you will not miss this due to connectivity or other challenges. So we're at the 15-minute mark. We have 15 minutes remaining to listen to your voices. Charlotte, I did see some hands that had been up that are down. Who shall we hear from next? Of course, we privilege those who we have not yet heard at Teach to Reach. Please guide us.
Loretta, we have Kingsley Ninyere, who has already spoken before, whose hand was raised, but also Andrew Nina. I hope that your audio devices and your connectivity will allow you to speak. I'm inviting you to unmute. Your hand is raised. And I know Kingsley Ninyere is quite passionate about malaria, Reda. So I kind of like I would not feel good not to allow him to speak during this session.
Time to hear, to hear a few more people. Yeah. So, yep. So we're asking.
So I'm also asking Angelina Jato. Earlier on, your hand was raised. I don't know if you waited. Okay. So Angelina, are you able? Okay, over to you, Kingsley, and then after you will listen to Angelina.
Right.
Thank you very much for the opportunity. I'm Kingsley Kofi Ninyere. I work for Community Development Foundation based in Ghana, Kintampo in the Bono East region. Yes, malaria is actually a deadly disease in my area. My family
has been affected by malaria. I myself have suffered from malaria, and my sisters too as well. Especially my sister who was pregnant during rainy season went to the hospital for ANC, and lo and behold, she was told that there's no IPTP. And you know, IPTP is given to pregnant women 5 times before delivery. And this IPTP protects the unborn child as well as the mother. But what happened here is that she had a malaria, which is to say malaria in pregnancy. And at the end of the day, there was anemia as well. And consequently, she missed the pregnancy. And it is something serious that is happening in my area here when it comes to IPTP uptake to prevent pregnant women from miscarriage, to prevent pregnant women from anemia, to prevent pregnant women from maternal death. So here, I do encourage that if you go to the hospital with that IPTP, then make good use of the ITN. Make good use of the ITN. So the ITN can protect you from mosquito bite. And also what happened here is that during rainy season, they make sure that all the waters that are in their containers, they cover it. Some have been telling me that they sleep well in the mosquito net. But what happened here is at the end of the day, they'll go to the hospital and they are confirmed malaria positive. And I said, yes, the issue has to be with outdoor. During outdoor activity, you have to wear things that can cover yourself, your entire body, to prevent malaria from, to prevent mosquito from being biting you. So aside that, that is what I've been doing, sensitizing the community members and sensitizing the pregnant women. And you know, children under 5, they are most vulnerable. The pregnant women and the children, they are most vulnerable. Even though all of us is at risk of getting malaria, but pregnant women and that of my and the children, they are high risk. So anemia in pregnancy, miscarriage in pregnancy, and then whatsoever has been the challenge. And I've been doing a lot in collaboration with Ghana Health Services to sensitize the community members about the importance of using mosquito net. Thank you, and I'm over.
Thank you, Kingsley. So the same question that we've asked the other speakers, just to understand, what would you like to learn about from your colleagues' experiences? So that's different from learning from experts, learning about things they have actually done, perhaps around this issue of prevention for pregnant women, or this question of supply of medicine, availability of medicines in situations where they're critically needed. What kinds of experiences could be useful to you? How do you can't solve a supply problem just on your own. So what would be most helpful to you, and what are you interested in hearing from your colleagues?
Thank you very much, Executive Director. Hearing from my colleagues as to how to make sure that this malaria endemic in our locality, we sensitize the community members about the dangers of mosquito bite so that they can prevent themselves from mosquitoes. And also, they make sure that they clear their gutters, prevent mosquitoes from breeding so that they cannot be. But quite apart from that, the drugs and then the test kits, that is to say RDTs, are not available. So policymakers and then partners can come to our aid to help us come out from this particular challenge.
Thank you very much indeed, Kingsley Nyere. So We hope we'll be able to put these questions to the group that will gather, to the malaria community that will gather, and we'll have, again, because we're working in partnership with RBM, Partnership to End Malaria, we hope to have a number of country and global partners, so national program managers as well as global partners that support malaria efforts in Ghana and elsewhere. Thank you very much indeed, Kingsley. Now, given that we have to start the climate change and health session, let me just do a point of order. We have time for maybe to hear from one more person, and if this short session leaves you thirsting for more, well, that's exactly the point, because again, this is a sneak preview of the special event that will be held on Tuesday, 10th of December with RBM. So right now we are this has my bookmark sessions, but these are out of order. So remember, in order to actually join the session and be able to speak, you need to first join the conference platform. So everyone who requested an invitation was pre-registered and is able to access just by clicking on the link. Otherwise, you do have to go through a free registration process. And to join this next session with Grand Challenges Canada, you'll need to reserve a spot. And that is when you can see that you are able to join the climate change and health session. If you do not reserve a spot, you will not be able to join the session, and therefore you will not be able to participate. I think this has confused a number of people who are looking for something, who don't understand, who are staying in the lobby where the event is being streamed, but where you're not able to interact in the chat or request to speak by raising your hand. So Charlotte, perhaps one last speaker, and then we'll have to close this session actually quite quickly before in order to start the climate change and health session.
Yes, Reda. So I'm inviting Barry Gariba. Very good to have you on Teach to Reach. Are you able to unmute yourself and speak to us?
Yeah, Charlotte, thank you. Thank you, Reda, for having me here. I'm so excited to be with the team again. We were together in the vaccination session some years back, and I'm now with the malaria crew. Actually, I'm Barry Gariba, the Monitoring and Evaluation Officer for malaria for the Northwest region in Cameroon. So I'm happy to be with you.
All right. And Barry, could you tell us about a time when severe malaria affected someone close to you? We only have a couple of minutes, and I know these can be difficult circumstances and not easy to speak about, but if there's anything you'd like to share, we'd love to hear it before we close this session and go to the climate change and health session.
Yeah, the most interesting part of that I will talk of is what concerns me directly. You know, some 2 weeks ago, given the workload that I had some fatigue, some little fever, and I just said to myself that maybe it's work, is the workload that I had. We did the rapid malaria tests, and it wasn't reactive. Maybe the technician who did it didn't follow the instructions very well, but I still felt bad. And unfortunately for me, I was out of station. We were in the field doing some supervision work, and I really felt bad. I said, okay, let me just go to the hospital and check. Behold, the microscopy showed I had severe malaria until I had they call it Coca-Cola urine. So it was actually severe. I was given some bed rest, and I had to take my drugs, and fortunately I came out of it. And I really felt bad. And I thought of, if I were not a health personnel, or maybe I was not where I had easy access to the health facility, it could have degenerated into something else. So I personally suffered from severe malaria some 2 weeks ago. So I know what it is, and it's really bad.
Thank you, Barry Gariba. We need to close this session now, but again, if this leaves you wanting more to share with colleagues from all over the world who are confronted by malaria, join us on Tuesday for the special event. We have more sharing that is just getting started. We'll continue on Tuesday. We're now moving to the climate change and health session. So this is going to require actually leaving this room, going back to the lobby, and then rejoining this time, joining the climate and health session. Remember, you need to reserve a spot. Otherwise, you will not be able to join the platform. I hope that's clear for everyone. Once again, thank you and goodbye. See you hopefully see you in a couple of minutes. Barry Gariba, Tijani Suleiman, as a special guest of honor, you'll be invited to speak on Tuesday. This is a mini session, so we hope you'll bear with us. and we ask for your indulgence. See you soon. All right, and for those of you who are looking at the viewing the stream, we're about to start the climate health and risks in just under 4 minutes. Let me see if we can get a counter in time. There's just even if there's just a few minutes left, we can still get a counter going. Or can we? Okay, yeah. All right, so please bear with us as we are having to adapt to a new platform. Yeah, here we go. Here's our counter. And even if it's just for a few minutes, so we'll still... There, we've got 2 minutes and 40 seconds. Now we're going to start up the session inside the Teach to Reach conference. And we keep the live stream going. Give us a few minutes to get started. All right, we've just started the session inside our conference platform. A warm welcome to you from Geneva, Switzerland. I'm Reda Sadki. We'll be starting this special, and we're very pleased to be holding this session on climate health, risks and barriers. We'll be getting started in 1 minute and 30 seconds. I'm here with my partners in climate change and health, Charlotte Mbu and Maria Fernanda Manzan. Welcome to both of you. We've been going at it all day, even though we did get for the first time a lunch break. Charlotte, what are your thoughts? We just came out of the malaria session. That was quite moving, hearing health workers share how they've been personally affected. This was ahead of the special Teach to Reach event on Tuesday, which we're organizing with RBM Partnership to End Malaria. What are your expectations? What are you thinking and feeling ahead of this session with our colleagues and partners from Grand Challenges Canada?
Yeah, I feel read that, like you said, the malaria session, though it was really a sneak preview, was quite touching for me. And I felt I left there, with a thirst for more, but not just hearing the experiences, but focusing maybe on the solution, on the actions that can be taken to curb the suffering. And I see this as it was also this session just as a continuation of the previous session, because malaria is actually a climate sensitive infectious disease, and quite a number of the experiences that were shared previously, people mentioned how climate change or change in weather is impacting. So we are just continuing from there in the session.
You bet.
Go with a different partner.
All right, thanks, Charlotte. We're counting down. It's tight going from one session to the other. We have to set up, reconfigure our studio, but we're pleased to be here for this special session today at Teach to Reach 11. And we're very pleased to introduce our partner, Grand Challenges Canada, for this session on climate health risks and barriers. In fact, we're going to see, I hope that that we'll be able to bring in our partner here. Again, the procedure for those of you who've once you access the platform is you do need to reserve a spot before you can actually access the session. So we're looking for our partners from Grand Challenges Canada, and looking. Okay, I see Maria Manzan from our team is also there. So a little bit more chaotic than usual getting started, but we're very pleased to introduce to welcome new partners to Teach to Reach, and very pleased to be welcoming Grand Challenges Canada. I'm going to ask Charlotte to share with us how Grand Challenge, how and why Grand Challenges Canada is supporting Teach to Reach and supporting health workers around this challenge of climate change and health.
At Grand Challenges Canada, we are committed to learning from those who are on the front lines of health crisis. With support from the global technology company and the government of Canada, we are partnering with the Geneva Learning Foundation to ensure that the insights and lived experiences of the local health community guide our search for innovations that are tailored to the unique challenges of climate-driven health risks.
Thank you very much indeed, Charlotte. And we're pleased to welcome Grand Challenges Canada to the Teach to Reach family. We're going to dive right in with this first question to those of you who are with us in the Zoom studio. But if you're watching on YouTube, Twitter, LinkedIn, Facebook, wherever you are, I see Joseph Ngugi is now joining joining from Moronga County. So he's with us in the studio. All right, and we have some of the guests of honor for this session. Please raise your hand if you receive the invitation as a guest of honor. We're looking forward to hearing from you. But first, to kick off, we have a question that anyone should be able to answer. It's really, how is climate change hurting the health of your community? So please, we are going to ask for our first volunteer for this session. Don't forget to introduce yourself. Before we go to you, and I see Mahesh. Mahesh, a warm welcome to you. Don't forget to introduce yourself and tell us where you're from, where and how you work for health, and then tell us how is climate change hurting the health of your community. And this is a question we've asked since July 2023, when we had the first special event on climate change and health. And it's always important to ask this question to understand from your perspective as a health worker what you are seeing, observing, experiencing. Mahesh, over to you.
Yeah, hello, Reda.
Yes.
Am I audible?
Yes, you are, loud and clear.
Yeah, so because I'm here in a very remote place in somewhere in Himalaya, so that's why I'm asking it repeatedly, because in my internet is not working well many times. So anyway, I am Dr. Mahesh Bhatt. I am a surgeon, author and public health consultant, working as a managing director and CEO of MMB SHS Trust, and it is a volunteer-based, volunteer-driven non-government organization, an NGO, and we are working on public health, climate change, and health, and training the frontline healthcare workers, communicating health, and health advocacy. So these are the multiple things we are doing. We are a regional organization. We are working in the Uttarakhand Himalayas. And so our problems are very much in line with this problem of the climate change. So today I am going to share with you a summary of a Himalayan story from the lens of a healthcare professional and an activist.
Yes, please.
So it is about challenging geography, economic and developmental activities, politics, and climate change, creating a vicious cycle, skewing social determinants and issues of availability, accessibility, and affordability of healthcare and other social services, leading to multiplied vulnerabilities, you can say. So it may reflect the issues of 15% of the global population living in mountains. So it's not particularly true with our problem. It is true with the people, the communities who are living in the mountains, and it is about 15% of the global population, you can say. So this story has three actors: the Himalayas, one of the most sensitive and fragile ecosystem in the world; the outside world, its people and their activities; and the victims, the local population. So it's not only about the community who are living in the Himalayas, but it's also about the people who are not living there, but they are creating problems. They are creating the issues of the climate change, like fossil fuel burning, a lot of other things, pollution, etc. And that is directly impacting the, what you call it, the climate in the mountains, specifically in the Himalayas. So the frequency and severity of extreme weather events, flash floods, forest fires, disasters, and new diseases like malaria and dengue have increased in the last 2 decades due to tremendous human interventions and developmental activities with the climate change consequences. We are seeing a steep rise in tourism that is exploiting the local weaknesses to create business opportunities at the cost of the environment. So the built-up area has increased in our area by 33% in the last 2 decades, and 60% of the construction is in unsafe zones and unplanned urbanization, which is hazardous to human health and the environment. We have lost 50,000 hectares of forest, creating tremendous biodiversity loss of human and wildlife conflicts. So why I am saying this, I am putting it in front of all the people who are listening it, that health is not only the responsibility of the healthcare professionals. It has got multiple sectors to get involved to get the better results. So it is creating significant economic and demographic imbalances and political and equity issues affecting the planning, allocation, and distribution of resources, and adversely impacting the social determinants of health, further forcing a lot of migration. They're further forcing migration from hills to plains. So the number of villages where all people have migrated has doubled in the last decade. So I want to attract your your attention towards it. The number of the villages where the all people have migrated has doubled in the last decade. According to the 2011 census, the number of such villages was around 1,048, and in 2024 it is close to 2,000. So we are advocating for health in all policies, and this approach is a solution. This is a solution. We are making it we are advocating it as a solution to break this vicious cycle and turn it into a virtuous one. It is because in the mountains, people, communities, and their systems are part of what you can say a fragile ecosystem, extremely prone to the consequences of climate change. If we keep health in mind while planning the policies, we have seen that it can act synergistically in solving issues and simultaneously help in creating favorable outcomes regarding sustainable developmental goals. That means making health systems and communities resilient and prepared, and helping them to develop sustainable solutions. So there are multiple vulnerabilities. The vulnerabilities are multiplying because of the issues of the climate change in this area. And I want to make it a point here that the people living in the mountains, specifically in the hills of the Himalayas, their contribution to this problem creating the climate change is almost nil. So you can say their carbon footprint is very, very low. So, but they are facing this problem, which they never created. So that is my point. Thank you very much.
Thank you, Mahesh Bhatt, for this expose. We thank you for your contribution. We appreciate, I believe you're amongst those who responded to the Teach to Reach questions, and we do look for that more comprehensive stories in the context of the live event. We have many participants eager to share their direct experience, things they have seen, what they have observed, and and their reflections on what this means. Before we go to our next speaker, we're going to look at the following. So we asked in 2023, in July 2023, we asked you 3 questions to kick off a survey, and we had over 1,200 responses. And this is going to lead into what we are doing in partnership with Grand Challenges Canada, and we'll be announcing for the very first time today at Teach to Reach 11 and inviting a select group of Teach to Reach 11 participants to join. So we asked you 3 questions. First of all, we wanted to know, as health professionals, what best describes your relationship to the community. And you can see that most of you consider yourselves to be part of the family. That's over half. And then if you add those who are trusted friends of the community, we're over 4 out of 5. And then we ask you this. Climate change is a threat to the health of the community I serve. That's what we said, and we asked you to say, well, do you strongly agree or strongly disagree with that? And you can see that most of you gave it a very high or even the highest threat level. And this was 1,234 respondents, both French and English speakers. So from, I believe, from 68 countries, if I remember correctly. So this was in 2023. We also asked you to what extent individually as a health professional you worry about climate change. And you can see here again that same threat or worry scale from 0, no worry, to the highest level, and you can see most of you actually assign the highest level of worry to this question. So that is why we want to open this session as we welcome Grand Challenges Canada to the Teach to Reach family. We have an exciting announcement that we'll be making together. We want to open with this question: how is climate change hurting the health of your community? And of course, let's be careful here, because malaria, heat stroke, asthma, malnutrition, waterborne diseases, many other afflictions are not new, and all of them can happen in the absence of any change in climate. So I'm now going to turn to Charlotte to lead us to our next speaker.
Thanks, Reda. So I'll be inviting Kaiser Haria from Saudi Arabia. You indicated in the chat that you like to speak, so over to you. And please do start by introducing yourself.
Good evening, everybody. I am Dr. Kaiser from Saudi Arabia, team leader and physician working in Ministry of Health. I am audible. Are you listening, Charlie and
loud and clear?
Yes.
Yes. I am working as a team leader and physician in Ministry of Health since from 20 years. I am one of the part of the National Tuberculosis Control and Prevention Program. Regarding climate, I suggested the government here in first I will introduce. It's I am from basically India. Nationality is India, but working as a resident in 20 years from MOH, as I told before. What is harsh climate is here is a very harsh, hot climate. The whole world knows desert. It is a big desert, Sahara desert. It is passing through Saudi Arabia and Middle East countries. So patients usually come to me as a dehydrations. It's stroke, sunstroke, dehydration, malnutrition, and a lot of other bronchial asthma aggravating factor. Lot of other things used to see. And used to go from government deputation to Hajj and Umrah. Millions of people coming to there. They have to walk a long distance to perform the rituals. During this, a lot of patients I have seen sunstroke. They fell down and they got paralysis also. Lot of complications happening. So I suggested the government now to make a green plantation around the whole Saudi Arabia. From the north, south, east, west, so that it increases the afforestation, desertation support, and increases oxygen concentration, and increases the health condition also, and carbon also, industrial waste products, everything it will be supported. And moreover, there is a no rain over here. So if you put the grand plantation, if trees will grow up, then rain will also come, clouds will formation. These are the benefits for the health. If oxygen is important, purification of oxygen, if anybody will inspire the pure oxygen, it will detoxify your body, and everything, carbon dioxide will be out from your body. So oxygen is very important, pure oxygen. So I suggested this. And these are the worst conditions I have seen since from a long time. So I suggested the government is an approval. We need a funds. So we are waiting for the approval from the government and funds, Dr. Reda. This is the things.
Thank you very much indeed, Kaiser Harir from Saudi Arabia. Let's keep going. We have people who are demanding to speak and who have important, I believe, experiences to share. Every experience that you have as a health worker facing what you think are consequences of climate change on health that matters. Charlotte, who shall we hear from next?
Okay, so Reda, I don't know. Can we try Andrew Nina again? Your hand is raised, and we really want to get to hear from you today. I also saw a comment from Shitu in the chat. Okay, and I see you're unmuted already. So over to you, Shitu. Are you able to share to elaborate more?
All right, thank you very much. I'm Salahuddin Mohammed Shitu, a social worker and a community development expert. So we had, I'm trying to share the kind of the experience that we had 2019 with the flood that we have in such a region in our community. So those flood has really taken so much of our pregnant women. They can't have access to road, and they end up like losing. Most of them lose their life due to bad road, due to the flood that we had. So, but for we collaborating with with the local with local transport authority, they really kind of like help us and see how we can move these women. So, but most important part of it, so by through the community engagement that we had and showing them that sense of belonging. So we now have a way that we construct a kind of semi route that is going to lead us to that primary health care. So which we have kind of really succeed in doing that. So I think climate change has really made difficult impact in the in most of the vulnerable pregnant women and the children. But right now, my NGO, we are really working on how we can have those elderly women and the pregnant women so that they can have access to clean water, and that is the most important aspect of the challenges that we're having at the moment due to the climate change that we have in this. So that is just what I want to share in a nutshell.
Thank you, Shitu Salahuddin, for sharing. Before we go to the next speaker, just to give Charlotte a minute to line that up, we're building on questions, Teach to Reach questions. You can see the format they came in by email. So these are sent to everyone who requests the invitation for Teach to Reach 11. And each time the questions, well, some are similar. This is not the first time we're asking about climate change and health, but we certainly have not exhausted the topic. And so you receive the questions in the weeks preceding the Teach to Reach event. And you see the little blue links. You just click on them and you're able to answer a range of questions. We asked you about a range of things, so you can see what we ask you and why it matters. And you can see here that with Grand Challenges Canada, will be hopefully the Grand Challenges Canada representative is on her way. We'll be introducing the partnership and making a very exciting announcement. You can see the first question is to tell us about trying to protect people's health from climate problems, but running into barriers, running into problems that prevent you from doing what you'd like to do to protect people's health, sharing experiences of extreme weather making it hard to provide healthcare, for example. And so, of course, feel free to still answer to speak to the first question, how is climate change hurting the health of your community? But we're most interested in the barriers. So tell us about something you are doing to try to protect people's health from climate-related problems, but you are facing obstacles. So back to you, Charlotte, for our next speaker. And of course, if you're a guest of honor, you shared an experience, and that is what we'd like you to share. Please keep in mind there are many, many colleagues who also want to share their experiences. Over to you, Charlotte.
Thank you, Reda. And I just wanted to say a warm welcome to Joanna Sanchez. That is from our partner GCC. That's in the panel, Reda. But we have Gifty Akosua that is unmuted. So Gifty, we want to hear from you. Gifty, are you able to hear me? I could hear you earlier on. If not, we'll turn to Margaret Nabagala.
Thank you very much once again. I'm Margaret Nabagala from Uganda. I'm one of the guest speakers today in today's meetings. I'll try to be brief. Climate change in Uganda these days, a lot of rain has caused a lot of changes. I spoke earlier about the increase in malaria cases because of the mosquitoes bleeding in these, a lot of water, just into the potholes in the roads, and that kind of thing, and these covered. And then other than the malaria, recently we had a very big hit. We had a lot of lives. We lost a lot of lives, up to 82 people dying because of flooding and because of soil erosion in eastern Uganda. Eastern Uganda, you must have heard about this. 82 people's lives were claimed because of soil erosion and flooding. Homesteads were flooded and covered with the soil, and many people. So they had to bring these, I forget the way they call them, but they were digging up, dead bodies out. I'm sure many of you heard about it. So that's part of climate change. When there's a lot of rains, the climate has changed and many things come out, and we are losing a lot of lives because of that. Thank you very much,
Margaret.
So Chair.
Can I ask you to tell us more about what you did in response to this? What did you do, and what were the barriers? What obstacles did you face trying to protect people's health in this situation?
The government has helped a lot in this, because earlier on we had also some soil erosion sometime, and people were told, the government made arrangements to transfer people, to relocate these people. Although some people stayed in those, when people are used to their locations, they really feel challenged changing from one place to another. But still today, the government has really called upon people, those who have remained, at least the survivors, to relocate. They are trying to plan new areas, and they are compensating, getting them some, because so many things were covered. Their household items were covered with the rains and flooding and the soil. So government is planning to give them some compensation in terms of cash, and to build them houses somewhere where there are no such things, such happenings. Because these people in the eastern, they are mainly located there are a lot of hills and mountains. So when they live into these mountains, when there's a lot of rains, the mountains start, the soil start going and going down, and the trees are washed down, and they go and cover people who are down, and those who stay in the lower ends. So the government is looking at helping these relocate, and maybe that place can be used for some other things like growing agricultural products and that kind of thing, so that we don't lose just the areas like that. And we are trying to also try to help educate the public on radio stations and also in the community gatherings about not constructing houses in mountainous areas, especially those which are risky. So that's how we are doing about it. Yeah, and also the roads, somebody I mentioned earlier that roads have been really damaged, and of course the accidents increase because of the potholes and that kind of thing. And we are facing a lot of trouble, and also with Malaria, which has increased tremendously. So that's how we are facing these days in Uganda with climate change. Thank you very much, and over to you, Chair.
Thank you very much indeed, Margaret and Nabagala from Uganda. We are going to hear from one more person, and then we are going, really pleased that Joanna Sanchez from Grand Challenges Canada has been able to join us, and we're looking forward to introducing you, Joanna, and asking you some questions about why and how Grand Challenges is supporting Teach to Reach, and beyond that, seeking to support actors, stakeholders who are trying to respond to climate change impacts on health. So Charlotte, back to you for our next speaker, and then we'll go to Joanna to introduce our partner.
Thanks, Breda. So Hydre Mohammed, and I know that we are having some glitches on the platform that is adding some characters to your name. So if I pronounce wrongly, just forgive me. Mohammed, your hand is raised, has been raised for quite a while. Are you able to unmute yourself and speak to us? If not, we are going to turn towards
We have
Adamu.
Ihe
And we'll
Jirika,
try.
Onye Nonachi, who's also unmuted. Are you able to speak to us? All right, we'd love to hear from you. And it's always, this is perfectly normal. It's amazing, remarkable that across so many countries, over 70 countries, we're able to connect in this way. So just asking some of you who, yes, Fatoumata Sangare, Alima Alkamis, voices we have not yet heard, I believe, at Teach to Reach. Nathaniel Muller as well, Omolara Adeyemi. We'd love to hear from you as well. You have been, okay, and I see Marta Trainer has to unmute. Fatoumata Sangare, Ihe Jirika, and Hydri, are you able to speak to us? We'll see. It's always a question of who's able to figure out. Yes.
Hello, Leda.
Yes. Who's on the line, please?
Hello, Reda.
Okay.
Hello?
Is that Halima?
Yes, Reda, I'm Halima Usman Al Khamis. I'm actually on a journey. That's why I can't really speak much because of the interferences.
Okay. All right.
However, I posted in the chat bot some of the complaints, some of the challenges we had as a result of climate in Yobe State. Sometimes earlier around in June, July, August.
I see.
We had series of floodings across almost 5-6 LGAs. However, the most devastating one occurred in Inguru, LGA. However, in brief, what we did was actually to help people was to actually intensify the IT, and that's insecticidal treated nets to people, and then to camp them in some located places around the LGA, so that they will not, because people were devastated, houses were lost, and you had to now even look out to people on even what they had to eat at during those period of time. So while we had series of cases of malaria and some other skin diseases that were erupting as at then, that we had to hospitalize and even take care of their hospital bills as at then. The government actually did a lot to see that people were lives were not lost. However, it was unfortunate to have lost 2 lives as a result of boat capsize. Two people actually died, and it actually was something to write home about. Immediately after that incident, we now had that of Maiduguri State and we had Borno State, and we had to even shift our semi-emergency response to Maiduguri for that rescue.
So Alima, can I ask you one more question? I understand that it sounds like you are at work. I'm going to try to ask you one more question. It's an important one, and it's the basis for why what Grand Challenges Canada is particularly interested in understanding in the situation you described. So with a flood and with this upsurge in malaria and other problems, you, of course, as a health worker, did, I'm sure, everything that you possibly could. What prevented you from doing what you wanted to do? Can you think of one example, something that was a real barrier, that if you had something to get through that barrier, you could have done much more to help people recover from the flood and to deal with the health consequences in particular? Can you think of a specific barrier that prevented you from doing what you wanted to do?
Okay, one specific aspect of the rescue was because the water was so much, we couldn't get access to electric boats. So what we did was we actually used the local boats available in the community, and that actually slowed rescue, especially in terms of people that were blocked in their houses as a result of the flooding. But however, it was actually a successful mission as at then, and we rescued a lot. And I'm sure if we had access to electric boats as at then, it would have been easier, and things would have not gone the way they had. It had to.
Okay, thank you so much, Halima Usman, and thank you for taking time while you are, I believe, in service to share your experience. All right, we're now.
Thank you, Ida. Thank
Halima,
you, Charlotte.
One last question for you, if I may. what would you be looking for from your colleagues? Is there any specific question that you would have about how they faced, for example, recovery from a flood and the health consequences of that? What could be most helpful for you to hear from colleagues about?
Well, it will have been. I will actually like to ask people to know how. I don't know. In UB, we have a kind of rescue team that was late. So, but I don't know how is it possible for us to have even have an earlier rescue than what we had as at then. If it is possible for people to share experiences on how they had to have an early, because I know if we had an earlier rescue, that's from the early warning sign of that flood, people would not have suffered the way they have.
Understood, Halima. So looking for Teach to Reach participants with experience in strengthening the preparedness and the speed of response as well when a climate-related event like this flood that you experienced and the other floods that have happened in Nigeria since takes place. Thank you so much, Halima. We're now... All right, so that's we've heard a series of compelling stories. Really appreciate those of you who are taking time while you're in service to join. We are now going to properly introduce our partner, Grand Challenges Canada. A warm welcome to you, Joanna Sanchez. We're going to ask you to unmute. Yes. Oh. Yes, please go ahead.
Hi, Redan. Hi, everybody. So happy to be here. So I've turned my camera on for a second. So I represent Grand Challenges Canada. For those who don't know Grand Challenges Canada, we are a Canadian-based organization, primarily funded by the Canadian government, but we partner with funders and organizations all across the world. We are focused in global health and humanitarian innovation funding. And so we fund local solutions to some of the greatest challenges facing global health and humanitarian context. And what's really interesting about Grand Challenges Canada is that we fund through a Grand Challenge model system, which means that we identify what are the greatest challenges or what are the critical barriers. So you'll hear Retta talking a lot about the barriers, and that's because we're very interested in what is it that is preventing us as a world, and specifically you that are at the front lines of these health issues in low middle income countries? What are the barriers to overcoming these health challenges? And so we fund solutions to those barriers. And to do this, we must identify what those grand challenges are. And so we are embarking on developing a climate and health funding program all across the world. And in order to do that, we need to identify our climate and health grand challenges. Now, we want to do things a little differently from what's been done in the past and potentially from some of the other funders, that we really want to take the questions to those best placed to identify the problems. And those are the people at the front lines of this climate crisis. And so, and that's all of you. And that's why I'm so happy to be here listening to some of those challenges that we're facing. The climate crisis is a global one. However, it's disproportionately affecting those countries, regions, and places that have contributed the least to climate change. And we're very aware of that fact. And so that's why we want to bring local healthcare workers and the health community, scientists, epidemiologists, everybody to the table to tell us what are the biggest priorities that you're seeing in your region, number one. So is it malaria? Is it flooding? Is it what are the challenges? Is it heat stress? And then what are the barriers to overcoming those challenges? So we are going to be launching a survey with the Geneva Learning Foundation that I'm sure Red has spoken about. And then we're going to be launching this beyond the Teach to Reach group, also to all our partners around the world. So everybody's partnering with us on this because we have a lot to gain. And so we're asking everybody to please participate, share within your own networks. We're wanting to get as much information as far and wide from locals. We don't want this to all this information and data to come from the global north. We want it to be the people at the front of the action and those involved in health action. Actually, it just came up on that slide there. And so I thank you for all your input. inputs. The climate crisis is not only creating new challenges. I've heard a lot about flooding here today, which is, of course, a massive challenge. We have wildfires, we have all types of storms, but we're also seeing that, and Retta mentioned this earlier, is that it's worsening existing challenges. We already are concerned about mental health and malaria and dengue and malnutrition, and climate health is just making all of these things worse. So we're going to be asking everyone, what is it that you're seeing that's the biggest challenge in your region? And again, the barriers. So happy to be here again. I'm Joanna Sanchez. I myself, I'm an epidemiologist and public health scientist, so I'm very passionate about this. And so thankful to be here today. And hello, everyone.
Thanks so much, Joanna. So, of course, we have some questions. So, first of all, as you know, Teach to Reach, there are, of course, many health workers in very different capacities, pretty much every job role, every system level. There are also organizational leaders who are looking for opportunities, looking for funding, resources to support the response that they're mounting to the challenges that they face that includes climate change impacts on health. Can you explain in 2 or 3 sentences how Grand Challenges work? What is the chance that a local organization, a small organization, a community-based organization could actually apply for and win secure funding from Grand Challenges Canada to do work that they consider is critical in their community to respond to these climate change impacts on health?
Thank you, Retta. Yeah, so as I mentioned, that this is going to help guide the new funding program that we're developing. We plan to launch that in early 2026, so sometime between January and February, March 2026. And this is going to be according to the results of this big landscape analysis that we're launching. This will be open to every country, every low middle income country. Unfortunately, if working in Europe or North America or Australia does not qualify, it has to be a low middle income country. We very much like centering local organizations that has innovations. We're looking for innovation. We're looking for big ideas for big problems. But we welcome everybody to apply. We will have, and if you would like more information about that, we invite you to subscribe to our newsletter, because we will be hosting closer to the date webinars in terms of how you can apply. The first step is, of course, contributing to the landscape analysis so that perhaps, you know, your greatest interest area could be selected as the priority for your region. We might actually be doing regional grand challenges if it turns out that the different regions of Africa and Latin America and Asia are showing different priorities. We might actually fund at the sub-regional level even, or perhaps continental. So stay tuned for that, but which will give different opportunities, of course. So there are ways to engage with us and join webinars and workshops to help guide the application process. We hope that there will be many rounds. This will be a multi-year program, and so if you're unsuccessful the first round, we hope to launch another one the following year and then the following year. So there'll be a lot of opportunities there. And the other thing I didn't mention is the results of this will also be published as a public good document, open public access to the world, to help NGOs and policymakers and other funders and researchers, and hopefully help guide some priorities. So we hopefully will have two big outcomes come from this big undertaking.
All right, thanks, Joanna.
More than 2 sentences, Retta.
right. So yeah, second question is why you're going through the process of doing this survey with and starting actually with the Teach to Reach network, as well as many other networks that will be engaging in this survey next year. Can you tell us why you chose to do it this way? You said it was a little bit different. Can you tell us more?
Yeah, so the first part of this, the last 6 months essentially, was speaking to partners, other funders, organizations, local organizations too. And a lot of the things came out of those conversations is that climate and health is quickly evolving, and people are very much wanting to put financing into the space, which is absolutely important. But in order to move quick, they haven't been able to properly engage local communities as much as they want. But there has been some local engagement. Of course, it hasn't been as wide scale as we would like it, because we would like as much input as possible. So one of the things that came out, and I was actually in speaking with some of the local organizations, where I was most impacted, where they said, No one is asking us. We are here. We are seeing the challenges. We are experiencing them. Ask us. Bring us to the table. You don't live this experience like we do. Give us the opportunity to provide input. So that really impacted us. We do try to engage local communities as much as possible, and we did that in our last Grand Challenge. However, it takes time when we do this at a face-to-face level. We can only do a few countries. This way, through an online virtual platform, such as Teach to Reach, where we're able to connect with so many people, but then we're also, with a survey, we're able to tap into massive, large networks, such as the Teach to Reach that the Geneva Learning Foundation leads, over more than 60,000 healthcare workers, and of course, many other partners that we're launching this with around the world, gives us more people that we can reach at the local level, those experiencing those challenges. So that's the why. That's why we really did want to bring that to the people and make this a participatory research exercise.
Thank you so much, Joanna Sanchez from Grand Challenges Canada, who's leading this effort of Grand Challenges Canada to listen and learn with those closest to the communities being hardest hit by the impacts of climate change on health. We're very excited to be working with Grand Challenges and to be partnering to develop and share this survey, asking each of you as health professionals, as members of the health community, what you are seeing, what is your perception of what is changing in climate, what is changing in health, and what barriers to action that you see. And in fact, we're very excited today to be formally announcing and launching the pilot of this survey, only exclusively for Teach to Reach participants, for those who have responded, who've contributed to this particular session and theme. We'll be reaching out to you, inviting you to help us test the survey to make sure that it makes sense to you and that you can see how it serves your needs. As you know, at the Geneva Learning Foundation, if we ask you questions, if we ask you to complete a survey, we make sure, and we're doing this very much with Grand Challenges Canada together, we make sure that your responses, your insights, your experiences are given back to you, as well as those of everyone else, so that it can serve your needs. Thank you very much indeed, Joanna, and we're very excited to be launching this together. And we're now going into the second half of this session. I've been showing on screen some of the questions that are in the survey. I'll go through them now. First of all, this is aimed at the health community, so we're most interested in those whose voices are seldom heard or infrequently heard, even though they are greatest in numbers, and that is community health workers and others who work at the community level, directly observing these impacts of climate change on health. So we'll ask you questions about that. They're really the core questions are what changes in terms of the weather, but also the climate. Which ones have you observed in your community? Which health problems do you think have gotten worse due to these changes? And then we ask you, as Joanna explained in the Grand Challenges approach, to focus on barriers, because if innovation, new ways of doing something are going to help, they need to be focused, aimed at the barriers to health action. So we'll ask you about those as well. And then we'll also ask you specific questions about the barriers in the community. So when trying to get your community to understand and act on climate-related health issues, what is the main area that you face? And in fact, I suggest we go there, going back to Charlotte, and inviting you, especially our guests of honor who have already contributed their experiences. Would love to hear from you in the remaining time of this session to get a sense of what community barriers specifically you see with respect to health action. Can you think of a time when you tried to get your community to take action on a climate-related health risk, but people were resistant, they hesitated? If you can tell us what exactly happened, how did people respond, and what did you learn from this experience? So we're going to open up the microphones if you'd like to raise your hand. Otherwise, we'll go back to some of you that we know we're ready to speak. If you do not have anything specific to share on this question, that's fine. We want to hear your voices. That's what this session is about. And this time, in this particular session, okay. If you have questions about grand challenges, how to access funding, or you want to express a need for funding, this is not the place to do it. So really, we invite you to share your specific experience of what you saw of how the community is responding, making sense of these issues. Let's go to Charlotte. Who shall we start with?
So I'm inviting everyone. You have the possibility to unmute yourself. So please go ahead and unmute yourself and share. Respond to any of the questions, any question of your choice.
Yeah, and we're particularly interested in hearing from people that we haven't heard from yet.
So people we have something to run about.
Benjamin, are you able to hear us? And we have...
No, that's what we are using.
All right. Let's go to Hassan Mohammed. I think you've tried to speak before. Hassan, are you able to speak to us? Usman Mohammed Tukur, same question. Imam Wada.
Hello.
Yes.
Usman Mohammed Tukur. I know you tried to speak before and couldn't, so I'm glad you figured out your microphone. We're listening.
Exactly. Thank you so much, Reda, for giving me this opportunity, and thank you so much, Charlotte, for this kind of wonderful series of events. I actually appreciate this kind of gathering, and I learn a lot of it. So actually, my concern in our community concerning this issue of climate change, some of the barriers are there's lack of sanitation in our areas. That sanitation is really matters. It used to block a lot of water passage, which when there is a heavy rainfall, it will cause a lot of damages, like flooding, like weathering and other things. But people doesn't understand. So there is need for us that we are working in the health sector to mobilize, sensitize people at the community level to know the importance of this sanitation, so that if there is any disaster that is coming to our community, it will be at a minimal level so that we can be able to manage it. That is one thing. And another thing, issue of this awareness is very, very key. We should look for a way. We are trying to look for a way to see how can we leverage with the state level, LGA level, and the community level to make very strong awareness group or awareness system that mobilize our people to know the importance of this climate change. People are taking it for granted, but it really affects our environment, our community, our even health. Thank you so much, Reda. I really appreciate it.
Thank you, Usman Mohammed Tukur. Of course, we have questions for you. So first of all, you can see on the right-hand side, are you able to see, I don't know if you're on your phone, it might be a little bit too small. Can you see the right-hand side? Can you read the text in the right hand?
Yes. What is the main type of barriers you face when dealing with the health issues caused by climate change in your area?
Sorry, I actually meant the right-hand side when trying to get your community to understand and act on climate health-related issues. So you have a list of 12 items. The last one is just that the main barrier you face is not on this list. Can you pick out which one is closest, is the best fit for you? If you had to choose only one, what is the biggest barrier when it comes to the community?
Actually, the first one, people do not believe climate change affect their health, because there is need for the people to know even what is the climate change, how is it related to their health. Typically, example now, if there is lack of conducive environment, lack of sanitization environment, there is a lot of blockage which give mosquito shelter that can breed to cause a lot of malaria in the community, and malaria is seriously affecting our health through even though like a pregnant woman, they used to experience such kind of malaria in pregnancy, but people doesn't know that malaria is related to their climate change. So that this really affects our community, and there is need for us to do a lot of sensitization to mobilize people to know this issue of climate change is related to our health. Thank you.
Thank you very much indeed, Usman Mohamed Tukur. We have some comments that go in the same direction. We should put it as our first priority, creating awareness to community people. That's Andrew Fanina. And then Lucy Adebayo says lack of awareness. Charlotte, over to you. We have time maybe for one, possibly two, if they're really concise and get to the point. Speakers, before we close this session, and we'll be going into the networking session, which will be the last part of Teach to Reach 11 for English speakers. So back to you, Charlotte.
Thank you, Reda. So we have Taban Anthony Stephen. Your mic is already unmuted. We haven't heard from you since morning. I hope we get to hear from you clearly now. Taban Anthony? So unfortunately, I'm inviting Onye Nunachi. You're unmuted. Onye Nunachi, your hand is raised.
It has been raised for a long time, and I think we tried before, so I'm guessing that they're having an issue. Adamu Gamawa?
Yes, sir.
Okay. All right.
Hello, everyone.
Warm welcome to you. Don't forget to introduce yourself, and maybe you can tell us, yes, what experience you'd like to share in relation to climate change and health.
I am Adamu Gamawa from Center for HIV and STD Research, CISTA, from here, Bauchi State, Nigeria. One of the challenges we are facing here, climate-related health risk, is deforestation. We understand that one of the reasons we are having most flooding here in this part of the country is as a result of deforestation, cutting down of trees. People are cutting down trees in mass, looking for source of energy to make firewood, to make charcoal for cooking purposes. And that is making the environment so susceptible to flooding. I think it's one of the reasons we are having more water accumulated in the community, which is breeding mosquito and is causing, is giving fertile environment for mosquito replication. And that is causing a lot of malaria spread in the community. So I think deforestation is one of the, is like the source of the problem of flooding that we are facing here. People have to cut down the trees because they are looking for source of energy to cook. And mostly there is no alternative but the bush, the available bush, to go and cut down the trees to make charcoal and make firewood. And that is excessively putting the environment at high risk of high risk of our climatic changes.
Adamu Gamawa, of course, you work for health, but can you tell us how you know this and what makes you think it is related, it is caused by climate change, these changes that you're describing? You describe the causal chain in terms of the change in weather patterns, then leading to ultimately to more malaria. But what makes you think it's climate change? Is it just your opinion? Is it because you know this is happening globally, you've read about it, or is it more than that?
Yes, it is known that destroying the bush can affect the climate, can cause climate dynamics. And it is known in the community also because there is a lot of awareness going around. People are being told to stop cutting down the trees because that is what is responsible. But there are many scholars on the media that are advocating, that are de-emphasizing that this cutting down of trees is the cause of the climate change here we are facing. So I'm not the only one here. Like the community themselves know, but it's like they don't know what to do. People don't know what to do, and there is no. Hello?
Yeah, so in your case, it is not, your perception is not that the community it needs more awareness. They have the awareness, but they don't know what action to take against deforestation and its consequences. Is that?
Yes, exactly. It is an ongoing discussion.
All right, understood. Well, believe it or not, we're already out of time for this session. It feels like we've just barely gotten the discussion started. Now, for those of you attending Teach to Reach today, or those of you who are part of a Reach network, look for the follow-up, the invitation to complete this survey from Grand Challenges Canada. Really a unique opportunity to make your voice heard, to make your observations, what you see because you are there every day, heard by Grand Challenges Canada and other global partners that are trying to figure out how to best target limited resources to support change on the ground where it matters most. We'll read a last quote from Fatoumata Sangare. From my own knowledge, and which is well known as a fact, climate change can cause abnormal increase in rainfall, leading to an increase in mosquito breeding sites, a target for the occurrence and increase of malaria cases. Yes, that does seem logical. We always ask you, how do you know that? Why do you think this is true? And that is how we get at the basis for what you believe to be true. Okay, we have more changes coming in. Barrier to climate change interventions, says Gregory Argogo, are at the global levels, which the government is trying to address. But there are more serious barriers at the family or homestead level. Issues like malaria, diarrheic diseases. This is the level where community mobilization is most important. Every time we've discussed about this topic, we get unique insights from this community. We want to thank Grand Challenges for its support to the Teach to Reach event today, as well as Teach to Reach 12 that'll be coming up in March. We'll be continuing this discussion, and you can also engage, make your voice heard by responding to this survey that will be coming your way, asking questions about climate, health, risks, and barriers. Once again, thank you and goodbye. Now, just to look at what's happening on the conference platform, we have the next session, and this is the final session of the day. Where did it go? Okay, starting soon, right in front of my eyes, is the networking session. So remember how the Teach to Reach conference platform works. You first need to reserve a spot. And then you can see the join button. If you're just watching in the lobby, so you're watching this right now, you won't be able to meet, network, and learn at all. You'll only be able to see, maybe there'll be a few people in the room, and that is those are the ones that we'll be speaking with. But the real opportunity is to go into this meet, network, and learn session so that you can actually do that. It does require changing from this Zoom room, going back to the lobby, and then coming back in for this session. So we'll see you. We have 2 minutes to get set up with Charlotte and Maria. We'll see you soon. All right, we're starting this final session of Teach to Reach 11. We've been at it for some of us since this morning. It's been fascinating hearing so many experiences being shared today, following the sharing that happens before Teach to Reach, what we call the Teach to Reach questions, where you can share your experience in writing. We wish to honor our guests of honor in the session today, and really, looking for. Right, I think I may be in the wrong session. So let me see if I can go to the correct session. Right, it is. So just hang on. We're going to the networking session that's supposed to be starting right now. It's entirely possible. Okay. There, we're now in the correct session. We should be able to start live streaming. Okay, wonderful. Yeah. All right, this is the final session of the day. We'll see how many are still left standing for this session. A warm welcome to you. We're going to try to keep the live stream going. We're not sure if that's going to work. What we're learning with this brand new conference platform, we're using this for the first time for Teach to Reach 11. It's really got some unique capabilities, but it's also got some challenges. So we thank those of you who've been helping us test and trial this platform in real time as we go. So this is the session to meet, network, and learn. We'll give a little bit of time for folks to join us. We don't even have Charlotte in the room with us yet, so we're going to. If you're watching, so this is one of the sessions where let me show you. Let me show you what happens. So if you are in the conference platform, this is a one session where you absolutely need to go to the networking session, to the session itself. Let me show you again how it works. You reserve a spot, and then you click on join. If you do not reserve a spot, you will not be able to join the session. And why does that matter? Because during this session, we're going to be going into small breakout groups, and that is a unique opportunity to literally meet, network, and learn in small group discussions. So we're going to get started with the networking process. And we're also waiting for Charlotte. Okay, there she is. All right. We're going to go back to some of the questions from. These were the questions that were developed by leaders of Teach to Reach. Just have to find them in a very long slide deck. And just to recall, we see benefits to engaging in this type of networking for individuals and for organizations. So benefit number one is to share your real world knowledge so that your team's daily work makes you experts. And through Teach to Reach, you can have this recognized by your peers, colleagues from all over the world, and other organizations, including global partners. Second benefit is by sharing experience. Every organization, no matter how small, how big, no matter what type of work, what field you work in, every organization can teach and learn at the same time. And then benefit number three is that you can become part of a global platform, network, and community. So you know that the challenges we face are bigger than what any one group can actually tackle alone. And Teach to Reach brings organizations together to make bigger changes than any one group could do. And then benefit number four is really to grow your team's skills through active learning. And this is where your staff and volunteers, you can get everyone, including volunteers, including members of a community, to join Teach to Reach. We know that the amazing growth of since Teach to Reach 10, where there's already 21,398 participants, all the way to 24,550 participants as of 4th of December. I think it's gone up again. We'll see if we can get to 25,000 this time, or if it'll be for Teach to Reach 12. We're very much looking forward to this. But the point is that there's a lot of leadership in Teach to Reach. Many leaders of local organizations, local government agencies, as well as regional and national ones, as well as global partners participating. So this led us to create the Reach Network, which we formed in October ahead of Teach to Reach 11, and building on the amazing set of partners, as well as more than 4,000 local organizations that participated in the Teach to Reach 10 process. So Reach for leaders. Reach is relate, engage, act, connect, and help. And then Reach, we do three things. One is special networking for leaders, such as this session and the Reach sessions that are organized before and after Teach to Reach, one-on-one meetings, a dedicated communication channel, which we'll be setting up. And what's unique about this network, we believe, is that you can see on the 6th of November, the inaugural meeting of the Reach network, over 300 participants, 45 countries, and you can see participation, this sort of broad, cross-cutting participation, everyone from community level to national level, including district and region, and then everyone from community-based civil society organizations, other types of nonprofits, all the way to government agencies. So what we're hoping you can discuss today is, first of all, we're going to do a first round where you'll be introducing yourselves in small groups. And then second, we'll ask you to share a new idea, something you tried in your community. So whether it was something you heard at Teach to Reach or not, but just to share with your colleagues something that you tried and that actually made a difference for your community. We also had this question. We started discussing this morning a conversation at Teach to Reach that changed how you do your work. So those are some of the questions we're hoping that you'll get to discuss in these sessions. And then we also, for those of you who are organizational leaders, we invite you to think about the best example of a successful activity led by your organization in the last year. We've talked a lot about the challenges, about the difficulties, the problems, but every one of you as a health worker working for health is making a difference through the work that you do and through the work of your organization. So we'd also like, as this is the end of Teach to Reach 11's main event, we have some follow-up events. We'd like to ask, what is a topic that you would like to discuss at Teach to Reach 11? We suggest this also as an additional topic for group discussion. Today, this is the last session for Teach to Reach on the 5th of December. But I already want to point out that we have some amazing follow-up sessions planned. Day 2, Friday, 13th of December. That'll be the next Teach to Reach session. And probably some of you certainly have already heard of the Lancet countdown. Of course, the Lancet is, many would agree, the world's leading medical journal, and they've been publishing a remarkable research on tracking progress on health and climate change. So we're doing a session with Marina Marina Marinello, who is the managing editor of the Lancet Countdown on climate change and health. We'll be doing a session. She'll be coming to present with her colleagues the main findings of the Lancet Countdown on health and climate change. And also she is coming to listen to you and what you are sharing and experiencing and observing as health workers close to communities that you live with. So Dr. Marina Romanello, sorry, apologies for getting her name wrong, will be doing a Teach to Reach session that is next Friday afternoon for most of you, morning if you're in the Americas, and late afternoon if you are in most parts of Asia. So that is one session. And then 2 weeks after Teach to Reach, right before the end of the year festivities, for those who celebrate Christmas, we'll be having the next meeting of the Reach Leaders and Partners Network. So this time will require you to be a Teach to Reach organizational partner in order to be able to join this session. But right now, we're going to go into networking. You can see we're a small group that is left standing at the end of at the end of this Teach to Reach 11. So we're going to go into breakout rooms, and we'll see if there's still people who stay in the main room. In that case, we'll keep the stream going. What we're going to do is we're going to do a first round for introductions of 5 minutes, and then you'll have a minute to come back into the main plenary. And then we'll do a second round, 10 minutes, then 15 minutes, and maybe if we have time, another 20 minutes before we conclude Teach to Reach today. So that, let me see, I think there are a couple of messages in the chat, and I'm going to turn to Charlotte just to ask if I have missed anything. For those of you who are here for the Leaders and Partners Forum, you may find some of the folks that were here in the morning for Geneva time. Charlotte, anything I missed that we should mention or share with participants before we close Teach to Reach today?
Not that I could think of, maybe just the possibility of connecting, that the platform also offers them the opportunity to connect with others, over 15,000 health workers that are already on this platform, but you will need to register, create a profile for yourself first.
That's right. And we showed this earlier, but I'm going to show it again. You can see the full participant list here. You can look, you may find people you know, you may find some of your colleagues are participating. And then, however, to engage with them, you go to the People tab, and there actually very few people have registered. But you can find a few that have and interact with them by, you see, in this account, which I'm using to show you Teach to Reach, it says to connect. Let me see, to connect with other users, log in with a Zoom account and create a Zoom events profile. So that is what you'll need to do. The same in order to chat with them. Okay, no, you can actually chat, but in order to interact with their profile, then you need to go a step further and actually register for Teach to Reach. So that is how you'll be able to, that is the other way in which you can stay in touch and find people that you met briefly. But let's, without any further ado, let's go into the networking. So let me just make sure we include as many people as we can. And here we're opening all the rooms, so everyone should be automatically taken to their breakout room. All right, and here it's always fun to watch this because the room literally empties, the plenary room in our Zoom studio, and then giving you 5 minutes to interact, to meet, and then we'll be coming back. Let's see. Okay, we do have a couple of people: Hassan Mohammed, Maheshbat Gifty. All right, and we do have new people coming in. I think in this case, if we can get everyone into the rooms and just make sure I can see at least room 2 hasn't started to speak yet. The other rooms seem to be doing okay. Mahesh, that we've heard several times speak today and had this profound, detailed story to share about climate change and health in the country where he works. All right, I see the discussion has started there. So it's always fun to watch this process. For those of you who are watching on social media, unfortunately, we cannot bring you into the platform unless you register for Teach to Reach. It's completely free. There is no charge to participate. And even at this late time of the day, you're still welcome to join, to meet, network, and learn. So I think what we'll do is to stop the stream. So we're going to close Teach to Reach for participants who are watching on social media. We're going to do a little bit of a review of what we did in 3 minutes during for this Teach to Reach 11. So this was to meet, network, and learn. Teach to Reach is about peer learning by and for people who work for health. And one of the main features of today's session was really learning from Nigeria's health leaders from the Movement for Immunization Agenda 2030, a remarkable story that we want to highlight. That was midday. But we started the day with the warm-up and tutorial asking you, as well as the opening ceremony, asking you what is Teach to Reach in one sentence, what Teach to Reach sessions will you join today? And we told you about what is Teach to Reach, really peer learning from health professionals. You can see that the curve of attendance keeps going up. We get more people joining each time. Now, the ways in which people participate has changed over time because there are many ways to engage, starting with Teach to Reach questions before Teach to Reach. This is where we send you questions by email. And we ask you, one of them is, what question would you like to ask to fellow health workers? How will this help you or your organization? So that now, Teach to Reach is part of a continuum of action from knowledge to impact. It's just one component in the Geneva Learning Foundation's interventions that really connect knowledge to action to impact. And we reviewed early in the Teach to Reach 11 this morning in Geneva what exactly we've done through Teach to Reach 10, which happened just in June. Now we have a minute 30 to connect, meet, connect, and learn for Teach to Reach participants that are right now in the breakout room. Teach to Reach 10 was all about health impact for local communities on the front lines of climate change. We're reviewing while Teach to Reach participants are in small group discussions, sharing experience, sharing their perspectives, their insights. we're reviewing what we did in the last Teach to Reach, which was in June 2024, so less than 6 months ago. On the front lines of climate change, for the first time, we discussed and explored and shared experience and community engagement to sustain malaria action. In partnership with Uniting to Combat Neglected Tropical Diseases, we explored climate in relation to NTDs. We announced the publication of the health worker experiences on HPV vaccination and the health worker tips from the front line, from actors who are actually carrying out this HPV vaccination. It's at Teach to Reach 10 that we launched the Immunization Collaborative as part of the movement for Immunization Agenda 2030. We also had a magnificent session, Humanly Possible, really the movement for Immunization Agenda 2030, celebrating 50 years of the expanded program on immunization. Quickly, Teach to Reach participants began to receive the outputs of Teach to Reach 10, starting with the recordings. We'll be following the same process with Teach to Reach 11, sharing with you the recordings and then the outputs, the experiences shared. Really, everything that was shared will be given back to you. And this in June was 21,398 participants, and we've 3,152 more registrants joined the session now. So we're closing the rooms now. And so this is an absolutely amazing number. This was as of 4th of December, so I'm sure it's gone up a little bit more. And we're now back for the Meet, Network, and Learn segment of Teach to Reach 11. If you're in the lobby or if you're on YouTube, unfortunately, you cannot participate, which is why I've just been reviewing some of the things we did today. Everyone is coming back here into the session. All right. We still have a few people. Breakout rooms closing in 27 seconds. So let's hold on. Actually, let's hold on the applause. And what we're going to do is hear back from the groups that just introduced themselves to each other already. Charlotte can tell us, were there any silent groups, or did you get everyone talking?
Okay, so Reda, I actually went to room 2 just to break the ice when you said no one was talking. And I got to launch the discussion, and I left shortly afterwards.
Okay, this was supposed to be just the introductions, but I'm not surprised at the discussion.
It was really just about getting people to start introducing themselves, considering that they are new group. So and I had to just invite one of the group members to say, okay, can you allow the others to introduce, and then when you come back for a longer round, you can get now to really discuss the work that you are doing.
Okay, wonderful. So the point here was just to do the intros. We're going to go back into a round immediately of 10 minutes, unless someone raises their hand or unmutes their microphone to share something about the introduction, something that they learned, something they would like to share with the entire group. We'll give you a few seconds before we go right back for a 10-minute round for discussion. Okay. We have Usman Mohammed Tukur. Please go ahead.
Okay, thank you so much, Reda. Actually, I joined a group of 4 people. 2 of them are new to the program, and one is 2 of them are new to the program, which is Saadatu Kabir and Timothy Gandu Ali, and me, then another Karen Ella from, I think, Canadian something, and everybody introduce yourself and share a little experience about the program. We make it very interactive by allowing everybody to introduce himself. Thank you.
Thank you, Usman. Over to Emmanuel. Emmanuel, tell us, how did your introductions in a small group discussion? This is really the heart and soul of Teach to Reach, is to meet, network, and learn. How did it go for you?
Wow, Reda, it's actually another pleasure meeting you around. And Charlotte, you're doing a good luck. And Maria Gonzalez, you're equally welcome. We are 5 in our group of, that's group 1. And we had 3 Nigerians, 2 who are professionals, they've retired. And 1 couldn't speak, but then the surprising thing, Mario from Greece, interacted well, and who is eager equally that we should be equally in the same group. He wants to learn more about how we can be able to, how we're breaking barriers in our different countries and in different states. But ironically, 3 of us are from Nigeria, so we're eager equally to go to the group to be able to continue our conversations and share ideas, share addresses, so that we can take off from there. That's all from you, and thank you.
All right, I hear you loud and clear, so let's do exactly that. This time you'll have 10 minutes. We'll come back, hear how it's going, and we'll do one final round, probably 20 minutes. Here we go. There's a few people who haven't been assigned, so we're going to put you into the rooms. You have the least... smallest numbers of people. Welcome to you. It looks like maybe some people haven't found their way to the session yet, and they're just in the lobby watching us. We're actually going to close the stream. We'll keep the Zoom room open, so but we'll close the live stream that's on YouTube once I've finished just sort of doing a little bit of a review in terms of let me see. Yeah, so Sule Kabiru, you should be taken to room 2. Okay, I see. And then Fanny, let me see where you are. You should be in room 3. All right. So Charlotte, just explaining to those who are watching the live stream that I'm going to finish doing a little bit of a review of what we covered today in Teach to Reach 11, and then we'll be closing the live stream that is going out on social media. We'll of course keep the Zoom room open in order to do that final segment, in which we'll leave people a lot more time. There also, one of the things I didn't say is that participants can actually change rooms if they feel that they have finished useful discussion with the colleagues that they're in the current small group discussion. They can choose to go to another room. Maybe I should make an announcement about that, but for those of you on the live stream,
well,
yes?
I actually think in this second round that is just 10 minutes. They could actually, I think some of them wanted really to follow up after the introductions, maybe hear what they are working on. And then the next round that is 20 minutes, we can then tell them, okay, if you think you've heard everything you wanted to hear in the previous room, you can now move to another one. So I think it still makes sense for them to connect further in these 10 minutes and then change rooms later on if they want to.
Fully agree. All right, wonderful. And Kaiser, you must have discovered that you are actually able to return to the main room. So we'll be explaining that in the final round of networking. So let's go back. As we said, today we had more than 24,550 participants, because that was the number yesterday on the 4th of December. We asked, because there's so many organizational leaders, over 4,000 local organizations, locally led organizations have participated in Teach to Reach 10, and many of those, probably more, are participating in Teach to Reach 11. So we asked how many people from your organization are in fact involved in this new Teach to Reach 11. We also introduced the REACH network. So really that's REACH is an acronym for Relate, Engage, Act, Connect, and Help. So it's a network for health leaders and really about sharing experience between people. Now, who is a health leader? You decide. If you have that commitment, that passion, that vision to work for health, then you'll be welcome to the REACH network. It does require your organization to become a Teach to Reach partner, but we offer special networking opportunities for leaders, one-on-one meetings, and then a dedicated communication channel. We said those who attended a Teach to Reach on the 6th of November when we launched, not Teach to Reach, but the REACH network, we saw a great and amazing cross-section of people. Let me see what else we had. We had the Leaders and Partners Forum. That was a really powerful moment where we honored many of the local organizations. Now, what do we mean by local organization? 1 is based in a community. 2 is mission to serve. Your mission is to serve community needs. 3rd, you are led by community members. And 4th, you are accountable to the community served. Now, you can be either private or public. And we asked why your organization became a Teach to Reach partner. So we're reviewing as we come to the closing of the Teach to Reach 11 sessions today. We're just reviewing what else we covered throughout the day. We honored the many different partners. I'm just going to show a few of the logos of organizations, some of them local, some of them regional, some of them national or even international. You can see many of the organizations participating in Teach to Reach 11 and that started their participation in Teach to Reach 10, where we first opened up Teach to Reach to local organizations. Just a point of order, if you have poor connectivity and have struggled with follow the sessions today, to join the conference platform, we do have a solution. It's called the podcast, and you can go on get the podcast as audio only and listen to all of the great stories and moments of Teach to Reach. And in fact, one of the high points today was listening to leaders from the Nigeria Movement for Immunization Agenda 2030, building on the call on the 7th of March 2022 to join the movement for Immunization Agenda 2030. Teach to Reach has been a milestone for this movement. A Teach to Reach 10 held an amazing session in which IA 2030 leaders shared their implementation case studies. And then also for World Immunization Week, we've been showing the many faces of immunization, inviting leaders of immunization at whatever level, whoever you are, wherever you work, whatever country, whatever your job role, to actually document the work that you do every day by taking a picture and sharing it with the global community mobilized around World Immunization Week. You also announced the release of the HPV vaccination health worker experiences and tips from the front line. We celebrated the Women Inspiring Women collection. Many Teach to Reach participants who are mothers, who are women, shared their advice, their insights, their experience with young women, their daughters, or other young professionals aspiring to a career in humanitarian or health work. We had a major session with the Nigeria Movement for Immunization Agenda 2030, and then came to Malaria, a kind of sneak preview, a short event ahead of the session on Tuesday through the partnership with RBM, the Partnership to End Malaria. We're preparing this special event on malaria that will be taking place on Tuesday, 10th of December. After that, we were not yet done because we came to the Climate Health Risks and Barriers session with Grand Challenges Canada. So Grand Challenges is another new partner for Teach to Reach. Together with RBM, they're the two key partners, anchor partners for Teach to Reach 11. We asked you, how is climate change hurting the health of your community? And finally, we came to this session where we've been coming together really to go into small groups. And the purpose is really the heart and soul of Teach to Reach, and it's to meet, network, and learn. So we're going to be signing off for those of you who are watching on YouTube or other social media, but Teach to Reach is far from done. I'll show you why, and I'll show you what's next. If you go to the conference platform, you'll see that the next event after today will be in English, will be the 13th of December. And this will be the Lancet Countdown, tracking progress on health and climate change. We'll be doing a special Teach to Reach session for two reasons. One is to present the findings of this medical journal's articles, research, and present this specifically for Teach to Reach participants. And then second, and equally important, Dr. Marina B. Ramonello, who's the executive director of the Lancet Countdown, is very keen to listen and learn, to explore how health worker observations, challenges, and insights complement the findings of the Lancet. So this is a unique opportunity for Teach to Reach participants to really join this global dialogue and to make your voices heard as health workers. After that, we do have one more session, which will be 2 weeks after Teach to Reach. So for those of you who celebrate Christmas right before that holiday period, and this will be the next meeting of the Reach Leaders and Partners Network. This time, rather than inviting everyone, we'll be inviting only organizational partners and staff and volunteers from those organizations. So that we'll be sending out the details and specifics of how you can sign up. We'll also be limiting participation. We want these to be small group meetings so that we can really really engage in peer learning specifically for health leaders. So I think that's it for Teach to Reach today. We're still in the Meet, Network, and Learn session. We're going to keep that open. Let me see how much time they've got left. Just got 44 seconds left, and we'll be closing. So let's close the... let's bring them back in. We'll keep the live stream going, and then we'll close the session as soon as we send them back out. Should be... All breakout rooms will close in 1 minute. Just to explain what we're doing and why it's unusually quiet, and I'm the only one speaking, it's because everyone is in breakout rooms discussing issues that matter to them. This is a unique opportunity. It's really the heart and soul of Teach to Reach, to meet, network, and learn. So they'll be coming back in 41 seconds. Charlotte, tell us how did it go?
Considering that it's a new platform that we're trying out today, but we have been preparing for this Teach to Reach over the past couple of months with our local organizational leaders through the Reach sessions, with the group networking, which started like 2 weeks ago. So I think as always, rich in insights, rich in experiences shared, highly participative, and we're glad to have our new partners, RBM, to end malaria, and GCC introduced and participating also fully at Teach to Reach 11. So I'm really curious to hear, to get what participants will have to say about the group networking. But so far, I think seeing how the microphones were moving in the various groups, I think we are going to be hearing some interesting stuff. Yeah.
Thanks, Charlotte. All right. Let's hear who'd like to tell us how the second segment went. 10 minutes. Mahesh, we'd love to hear from you. You've been able to contribute, and we truly appreciate contributors like yourself. Mahesh, what happened in your discussion group, in your to meet, network, and learn? What are you taking away? Before we put you back in, there's going to be one last round, I believe, for 20 minutes before we formally close. So what happened?
Yeah, well, of course, this time we decided that how our networking we should go ahead with the opportunity of networking within ourselves. Try to understand our long-term goals and plans, and for that purpose, all of us we were 5 people in the group from. Ghana, Nigeria, I was from India, and so on and so forth. So we decided just to connect with emails and personally in the group, and then one-to-one interaction as well. So if somebody is doing some work on the immunization and other part of the world, somebody else is also doing the same thing on the immunization, so they can connect with each other, and they can discuss the issues and the barriers and the problems, as well as not only the problems but as well as the breakthroughs that what they have during the.
Did we lose Mahesh? Okay, well, we heard very interesting to hear how these group conversations are going. So this is a small group discussion. We used to do one-to-one conversations, and those are amazing because you really get to be with one other person. Mahesh seems to have lost his voice or lost his connectivity. I hope it's the latter. Anybody else would like to tell us how it went for them? Please just go ahead and unmute. We're in the meeting configuration of our conference, so anybody can really speak up and join.
Hello.
Yes, Usman, please go ahead.
Yeah, thank you so much, Reda. Actually, this second round the group discussion is very fantastic because we had a group of 5 people. One of them is Carrie Ella from Georgia, who is part of quality analysis analytics, and the other one, 2 of us from Nigeria. So the 3 of us from Nigeria, Saadet, Kabir, Timothy, and me. And the other one doesn't say anything because we didn't hear from him. So actually, we agree that this connection, this networking is very, very key. We agree to connect ourselves so that we can share ideas, we can share skills and experience, some strategies that can help us to achieve our target in our place of work. Because if you have some particular issue that are very difficult for you to solve, having had an opportunity to discuss with other person, maybe he has the strategies he adopts in his environment that can be suitable for you to adopt in our own environment so that you can solve that particular program or problem. That's connectivity, networking is very, very important. So everybody agree so that we can solve our challenges we are facing in our community. Typical example of this issue of climate change. This issue of climate change is affecting so many things in our environment, but people doesn't know. So we agree that we have to make a strengthening, we have to make a capacity building toward awareness program, starting from the federal level, state level, LGA level, down to the community level, so that we should leverage at one point so that we can get rid of any challenge that will come to affect our community, to affect the health of our people in our community. So actually the discussion went very clear, very interactive. Everybody participated. Thank you so much, Reda.
Thank you very much indeed, Usman. Is there someone from another group who'd like to share, or maybe someone who was in the group with Usman who could tell us how it went for them? Please do go ahead. You should be able to unmute yourselves without needing to raise your hand or anything like that. So we'd just love to hear from you. Sadatu Kabir, you are sharing your approval. We'd love to hear from you. We know everyone in this room is able to speak, or almost everyone. Otherwise, yes, Sadatu. Yes, Sadatu.
Sorry, I'm surrounded by my children as a mother. So I'm just wanted them to keep quiet so that I can talk with you guys. I'm so sorry. I want to let them go to school. They are going for school now. So they will be disturbing the group. Okay, maybe later. Thank you.
So that's Kabir. Thank you for letting us know. Let's go.
What about Dr. Timothy? Dr. Timothy is around. You can say something. Oh, Karen Ella from Georgia, she can say something. Please, part of our group. Somebody can say something.
Sure, we'd love to hear 2 perspectives from the same group, 2 or 3 perspectives, before we put you back in for the final round of 20 minutes.
Okay, I'm back. It's harder too.
Yes, go ahead, Sadatu, if you're able to share now. We'd love to hear from you as well as from
yes,
the others.
at my own level, we have a very good structure in Bauchi State at the Primary Healthcare Development Agency. From the local government health authority down, we have a committee at the community level. That's the ward chairman committee and the ward engagement person. We have a community resource group that they can go house to house. A community resource group that we name them Mama to Mama, where they can go house to house to assess their problem need, and they can even brought them back to the primary health care clinic or facility so that they can have access to any health services that they needed. In terms of hard to reach area, those people within the community, we train them and we give them access. And if there is any issue related to transportation, there were some people that we train. That's the emergency transport system. So where they can use so many things to transport any sick person, emergency case, down to the facility. That's part of our challenges or way that we used to carry on things at the primary healthcare level in Bauchi State, Nigeria. Thank you.
Wonderful. Thank you, Sadatu Kabir. And I am sure it sounds like you have very disciplined children. So let's go back to the final round. This one will be 20 minutes. So you should find yourself in the same group. and then we'll be coming back to Close Teach to Reach. While you're away in the breakout groups to meet, network, and learn, we'll be closing the live stream for those of you who've been following on YouTube, Twitter, LinkedIn, and so on, Facebook as well. And then we'll be closing the session once we come back from that. Maybe we'll hear again what's happened in 20 minutes. Note that we haven't told you this, and this was Charlotte's clever idea, but you are able to move from one room to another. So if you'd like to see how that works, you need to find the little breakout group icon in your Zoom. You see that's the 4 little white squares, and then when you click on that, you should see the different rooms appear. And if you'd like to visit another room once you're done, if you finish early with a conversation with your current colleagues, you are allowed to go to a different room. So let's open all the rooms and send everybody back in. We hope you enjoy this. This is really the heart and soul of Teach to Reach. Here we go. So one final call for anybody who's watching the stream or the recording later. Again, we want to make sure that you don't miss the next Teach to Reach session. So of course, if you speak French, we have Teach to Reach in French offered tomorrow. But really, if you speak English, the next meeting for Teach to Reach 11 is with the Lancet Countdown, tracking progress on health and climate change. We're having a special Teach to Reach session. We'll be welcoming Dr. Marina Romanello, who's the Executive Director of the Lancet Countdown. And really the purpose of the session is one, to present the Lancet Countdown's findings. If you're not familiar with this medical journal's yearly annual publication of the latest research, the most significant insights and data that that allows us to better understand what is happening with health and climate change. So we'll be doing that. That'll be the first part. But there is another very significant reason why Dr. Marina Romanello wants to accepted our invitation to join the session, and that is that she is keen to listen and learn to the perspectives and views of health workers, and to explore how health worker observations, challenges, and insights can actually help us refine and gain new insights into the data. That's the formal quantitative data and epidemiological data and research that helps us understand climate change and health impacts. So that will be on the 13th of December. So that's next Friday. In the meantime, we'll be closing the conference, but I think the space is going to stay open. So if you did not have enough time to figure out how to really tap into the participants list to connect with your colleagues, you do need to register in order to be able to create your profile and really show off. I'll show you a little bit of what that looks like. So if you go to the People tab, but very few people got to do this. We announced just 2 days ago that we were opening up this platform and pre-registered everyone all at once. But you can see here you've got a profile, and by going to, you can visit other people and leave messages and connect with them. You can also see more about their background and what they actually do. So for example, Barbara is the founder, president, CEO of Citizen Center Pub Life. So you can see more about her background, and the people who've actually filled in these profiles can get in touch with each other, but that does require a specific registration. That will remain open, I believe, until the first week of January. As we announced today, we'll also be launching the Climate and Health Survey with Grand Challenges Canada. So we'll be piloting the survey with a test group from Teach to Reach participants. So some of you may receive the invitation. We're not going to go out to the entire community yet, but we are going to be piloting the survey with your support. So I think that is it for this Teach to Reach 11. We hope you've enjoyed this. We hope you stay connected to meet, network, and learn. Once again, thank you. Charlotte is here, so I think, whoops. I am going to ask her for her final reflections before we close.
Thank you so much, Reda. And first of all, I would like to thank everyone that participated in each of the sessions today, but most especially those that have been there since morning and were part and parcel of each and every question. Each and every session. I also want to especially greet our guest of honors, those that contributed to Teach to Reach prior to the main event, because Teach to Reach is not just what happens today, it's actually what happens before, during, and after. And just to say, this is just part of a journey. It's part of a timeline. We are looking forward to connecting with you again next week for our special event, Malaria, where we'll get to. Today was just a sneak preview. We have lots and lots of other experiences that need to be shared. So better register to join, reserve your spot so that you don't miss out on this powerful event where you get to hear frontline voices. I read the experiences that were shared by frontline health workers on how malaria is impacting their lives, their communities, and their families, and what they are doing to help their communities tackle the challenges caused by this infectious disease. You don't want to miss this opportunity to hear from them and to read some of these experiences. They are so powerful, Reda. And I know I'm taking much time saying this, but I don't think I've had enough time to really share what I've learned by going through the experiences on malaria. But that is not all. We also have climate change and its impact on health in partnership with GCC. I also read hundreds of experiences shared by health workers, and you want to be a part of the Teach to Reach family to have access to all of these outputs that are coming out of experiences shared by frontline health workers. And even if you are on a global partner or on the global space, you want to connect with what health workers are doing on the day-to-day to tackle these global challenges. As a final word, I also want to say thank you to the team behind Teach to Reach. That is the other members of the TGLF team. We have our partnerships coordinator, Maria Fernanda Monzon. We have our communications coordinator, Amara Khan. We have the Insights team, Ian Steed, Ian Jones, Carrie Ella, and all the other members of the Teach to Reach team, and most especially Reda for hosting this event today. And also to those that shared so many experiences, I also want to thank them, Reda. You know, it's been great, and I can't wait to be a part of Teach to Reach 12 in March next year. But before then, we have so many things that are going on in the Geneva Learning Foundations. We are always looking for ways to engage with you and to amplify your voices. So better subscribe to our social media channels so that you don't miss out on any news, any opportunity, and any information. That was my final word, Red. I think it was more of, quite long, but
no, that's fine.
Thank you so much.
I can hear that you put so much heart into it, and it's absolutely normal that we as facilitators refrain from intervening, from getting involved in the discussion. Our role is to make things easier for others to share experience, but it's obvious that we are thinking as we do this within our role. So thank you, Charlotte. Thank you, as you said, thank you to the entire team that's behind the scenes at Teach to Reach.
For the layout,
All right, yes.
Thanks.